That's right, Lagos. Every single Thursday, I get super excited because of one thing. I am getting closer and closer and closer to my doctors. I've made different confessions about how I barely visit a hospital. I barely get checkups. But every Thursday, I have someone somewhere coming here into the studio just to talk about life, talk about health, and talk about everything. Today, I got Nurse Udeme in the studio. Good morning. Welcome. Good to see you.
Good morning, Chacha.
Good morning.
It's a pleasure. I really appreciate it.
Good to have you here. Now, I must confess, you're the first person that I've met in my life who bears the name Udeme. The only time I've heard that name is from an advert. You know that advert?
Exactly.
Yeah. So when the adverts came, were people playing with your name?
Sometimes it did, but it's over now.
It's not over. My friend Udeme.
That's true.
Welcome. Today, Lagos, we're talking about the realities of breastfeeding in today's world. I did take a story a couple of minutes ago about how a nursing mother in one state, this lady had her child taken from her. And I was talking about it during the 8 o'clock hour, and my co-host was saying how, you know, some babies are snatched from their mothers. They don't get to be breastfed. They don't get to, get all that love. And I'm curious because at the end of the day, we've heard that breastfeeding is one of the important things after childbirth. But what do new mothers need to know about breastfeeding in the first week?
Breastfeeding is very important for new mothers and very important for babies too. Though it could be a little bit challenging, it's a learning period for both of them where the mother learns how to adapt to breastfeeding and then the baby how to leach to the breast. So it's a little bit a learning period for both mothers and babies.
Is it?
And then the mother should also learn that first milk that comes after birth is very paramount for the baby to have. It's called colostrum, and it's very nutritious, and it has good, well packed with antibodies for the baby's well-being.
Right. Okay.
So she needs to know all that.
So what should, expecting moms or moms expect in the first 72 hours after birth?
Immediately after birth, the mother is expected to put the baby to breast because breastfeeding starts immediately.
Okay.
First hour of birth, the baby is put to breast until the baby gets to about 6 months. That's what we call exclusive breastfeeding.
So it's advisable to breastfeed for 6 months?
Yes, 6 months and above.
Okay. They say something about clicking. How long does it take for breastfeeding to click?
To the mother? Well, it's just her adaptation, her understanding the reason why she's breastfeeding and how good breastfeeding is for the baby. So once it clicks, she gets it.
Okay. So a lot of people have said that they can't eat this, they shouldn't eat that. I personally, I'm of the opinion that when I'm breastfeeding, I should just be eating some sweet food so my baby will enjoy. No bitter leaf soup, no agbo, no, pepper soup, because I don't want my baby's throats to burn. But is it true that, breastfeeding mothers should have certain meals or certain things that they eat?
That's not true. It's just a myth.
It's just a myth?
It's a myth, and that's not true. Because if you don't eat well, you don't get enough nutrition into you, and it's what you get in. That's what comes to the baby through breast milk.
Okay, so the baby is not tasting my afang soup.
No, the baby has nothing to do with your afang soup. It's just the nutrients in the afang soup that the baby gets to get.
Okay. Now, some people say that when you're breastfeeding, you shouldn't take alcohol and other substances, but you cannot taste food, but the baby can taste alcohol.
Yes, alcohol can infuse into your system, and that's why babies there's what we call alcoholic syndrome. So the mother does not need to take alcohol while breastfeeding. It's paramount.
What is alcoholic syndrome?
Alcoholic syndrome, it gets to affect the baby.
So the baby will be drunk?
Not really getting drunk, but the baby will have some malfunctioning issue.
Oh,
so it's
okay.
better the baby does not get it into his or her system at all.
Okay, so I think you're arming me with a with an insult to someone. So it's safe for me to tell somebody that it'd be like say your mama drink alcohol when them boy you.
Don't do that. That's not be nice.
It's not like telling the person something is doing you. No, so then, man, why did you off my lights now?
I'm sorry.
That's right. We're talking about breastfeeding. So if you know a breastfeeding mother, tell them to just tune in and let's talk. Some of the stories or some of the things that you need to hear. If you're too lazy like me to go to the hospital, which you need to, don't worry. We got you every single day of the week. Every Thursday from 9 to 9:30, we talk about stuff. Nasidem and I are talking about breastfeeding because I'm preparing myself for, some, is it months or years? Hopefully months. Nasidem, are you prophesying into my life? Let's get it on. We're talking about breastfeeding. How does a mom know when the baby is getting enough milk?
Baby stops feeding. She stops suckling.
Okay.
Once the mom is breastfeeding and the baby is filled, see her detach from the breast.
Okay.
Stop suckling.
Now, I want to ask a certain type of questions because a lot of people say that certain things you don't do when you're breastfeeding or you can't do. One of which is, can you breastfeed when you're sick or on medication?
It depends on the medication. If you can breastfeed when you're sick,
okay,
then the doctor will tell you this medication is not good for breastfeeding. Most times, if you take your medication and you take the leaflets, you're going to see in the leaflets not for breastfeeding mothers.
Okay,
so that you avoid.
Okay, so should a mom stop breastfeeding when her baby gets teeth?
Oh,
okay. Isn't it painful?
It's a little bit because the baby tends to bite a little. Once you'll notice that the baby bites and then looks into the mother's eyes to see the mother's reaction. They're very smart.
Really?
Yes, they do. They bite and they look at you. So you just tell her no.
I will pinch the baby back.
You don't have to. You just tell her no. Let her understand you.
Okay.
Both of you have a link, a communication, and you'll notice that the baby will release the teeth. Good.
So I watched a friend of mine a couple of days back. She came to Nigeria with her baby. And I was just, my friend and I, we have the same cup size. And then I was looking, I say, yeah, what is this? What is this watermelon on your chest? And then the baby was breastfeeding. And I'm sure some people would, if people didn't know me, or they would have thought that I was perverted because I was just looking at I was looking like let me see and the other part of her breast, she said the baby doesn't like this. Does that happen normally? Like a baby likes one particular side of breast, doesn't like the other. Is there any cause for that?
Well, the reason is because probably that side of the breast is not lactating properly.
Okay.
If the ducts there are not opened enough for the baby to suckle. So once the baby is on that side of the breast, there's no milk coming much. So she tends to prefer, the baby tends to love the side that is lactating better.
I think
that's why that side is like that. That's why she tends to believe that the baby doesn't like that side and the other side is good for her.
Is there anything a mother can do to?
Yes.
Okay.
She should massage, she should clean the breast, the nipples the more. She should try to, there are some little dirt or dried skin that seals the duct, there's a little bit of that, some tiny dots, some tiny holes on the breast. So if that is sealed by dirt or dried skin or leftover milk, stale milk, you need to clean it off. You need to get cotton wool, dip it in water, and just scrub.
Oh God, I wish she was listening, but I would have to tell her after this because she was just complaining. I don't know what's happening, and that left breast was hard as a rock.
Oh, that's engorgement.
What is engorgement?
Engorged.
So when the breast is hard,
the breast is hard, it's engorged. It's not a good thing because it's going to be very painful. She'll start having headaches. She'll start having fever. The breast will feel warm. So what she needs to do is to try to get the ducts open and then express.
Okay.
That's when the partner comes in, the help from the family and partners.
Okay, I need you to be a little bit more vocal.
Oh, sorry.
Go ahead.
So that's when the family, the husband, the partner comes in to help. He can either help to clean, or sometimes we equally advise them to help bring out the milk, as in express.
How will they bring it? Does the man suck the breast out like a baby or press it?
he has to press it, because now he wouldn't want to to have the breast milk in the mouth.
Okay.
But if he's able to suck and spit, that's fine.
Because we've seen on social media how some yes, you said here. I like the fact that you said it helps. You're saying it with such low tone. You're saying it like I don't want men to hear it so they won't be disturbing their women. But we've seen on social media where a lot of men, a particular guy has said that since his wife started breastfeeding, he started getting breastfed too. And I remember the comments, people were saying, how can you be, that is for the baby, it's not for the man. But it's advisable for the men to help.
It helps. It's advisable for them to help, especially when the woman have an inverted nipple.
Mm-hmm.
If the nipple is inverted, the man can help suckle on the nipple for it to come out.
Mm-hmm.
Get out the teat for the baby to be able to latch on.
Okay.
Because if he doesn't help, then the baby is not going to have good latching, and no breast milk is no good breastfeeding is going to come.
I know some of my guys are happy now. They will take this and say, I'm sure somebody has recorded this conversation and say, baby, you hear say then tell you say make a do it for you. But moving on from that, quick question: does the size of a breast determine how much milk will come out?
No, it doesn't.
No, Udeme, please.
No.
Just for
no, it doesn't.
I need to hear that again, just because of some certain people who have insulted me this life.
Breast milk. Mm-hmm. The amount of breast milk that comes out of the breast it depends on demand.
Mm-hmm.
The baby's demand. So it doesn't matter if the breast is large or small. It's just to feed the baby on demand.
You see, I have Amon now, so when I talk to my mother, or I talk to my sister, or I talk to my brother does not insult me like that, but my sister, my mother, they will say, look at you, what's with your baby? Oh, that's them. I like it.
Funny enough, small breasts lactate more.
Oh, God sent you here. God sent you here to shame my haters. Nurse Udeme has given me life today. She has given me so much ginger. She has said some things that I will hold on to for a very long time. One of which is the size of the breast does not matter how much milk you're having. And also to my guys, if your nursing wife or girlfriend or mother, is out there and she has difficulties, Nurse Udeme has given you go ahead. She said, go forth and help your woman to, deliver. This is Base 101.1 FM. Good morning. My name is Chacha and we're talking about breastfeeding. I mean, a lot of women are out there trying their best to, feed their children. And I'm curious. We've had so many myths, so many stories, so many questions about breastfeeding. Some people say that breast milk can actually help cure illnesses. Is that true?
Very correct.
Because
breast milk is packed with nutrients and antibodies.
Does it help cure illnesses with children or with anybody?
With the mother, if the mother is breastfeeding, it prevents mothers from having, if the mother breastfeeds exclusively, and from time to time it prevents her from having illnesses like breast cancer.
Okay.
It prevents her from most kinds of female reproductive cancers, and then it also helps the babies. It prevents brain damage. The baby's healthy. It prevents so many
things,
illnesses in newborns. Okay. So I was asking that in reference again to hearing that men can help with if there are issues with the breast. So can a man? So my men that are listening will not come and say, "I'm sick. I need to be breastfed." It has nothing to do with the man.
Okay.
It's just with the mother and the child.
Okay. Are there certain foods or drinks that a nursing mother should avoid?
Apart from alcohol, she should not take alcohol, like I said before. But every other food is good for her.
Okay.
She can go ahead and eat whatever she has been eating. And if she wants to introduce some new foods, if she's not allergic to them, she's fine.
Okay. Now, in the African society, we've had situations where people say, if you don't breastfeed your child, you are not doing well. Some people are frowning on breast pumps and milk storage. Please, let's talk about that a little bit. Is there anything bad about pumping your breast milk?
There is nothing bad about pumping your breast and storing the milk. There's nothing bad about that. because let's say, for instance, mothers will have to go to work. They'll have to resume back to their different areas of duty. So if a mother needs to do that, she needs to pump some breast milk, and she has to do the exclusive breastfeeding. She needs to continue breastfeeding her baby, and she needs to pump the milk and serve it in the house.
Right.
Keep it in the fridge, the refrigerator, at the back of the refrigerator. You don't put it on the door because you keep opening, so we need that temperature to keep the milk, to preserve the milk.
Okay.
And then if you have to keep longer, you store the milk in the freezer.
Okay.
So breast pumping is not a myth, it's not a problem. It's just you having enough milk to take the baby through all the day, because you're not going to be there to feed the baby from time to time. The baby, sometimes you have cluster feeding where the baby suckles every minute. She comes, she takes a little, she goes back, she comes, she takes a little, she goes back. And then how will you manage that if you're not at home? So you need to preserve the milk. You need to preserve to have enough reserve for the baby to take whenever the baby needs the milk.
Okay.
So
yeah,
breast pumping is good.
Okay. Also, does breast milk expire?
It does.
Okay.
It does expire. For freshly expressed breast milk, it stays outside at room temperature for 4 hours.
Okay.
After that, the baby can't take that milk. It's sad.
Oh, okay.
So you discard. Then if it's going to be in the refrigerator, not the freezer this time, the refrigerator, you can't keep for more than 4 days.
Okay. Okay.
If it's going to be in the freezer, it stays for 6. It can stay for 6 months, or 6 weeks to 12 months.
Okay.
So that's it.
All right.
So after that, you discard. And once you get out the breast milk from the freezer, you thaw, you warm, you feed the baby. You don't refreeze the milk. You discard if it remains. You don't take it back to the freezer.
So once it's out of the freezer, it should be used up.
It should be used and then discarded.
Okay. I see. I'm just, wife material zone. That's where I'm getting into. Now, so then let's debunk some of the most common myths around breastfeeding. Some people say that breastfeeding comes naturally to every woman. Is that true?
That's true.
Okay. So is it a skill? Is it something that you have to practice, or, how does that happen?
Well, for first-time mothers, you have to teach them, show them how to hold the baby, how to help the baby latch to the breast, because if not, they're not going to latch properly. The baby would only stay at the nipple, and then there can be soreness to the breast, so the mother gets to have that pain and all that. And if she's not breastfeeding the baby well, the breast gets to engorge, so she needs to learn how to do that.
Okay.
So all those things she needs to learn. That's a new mother.
So the engorge thing you said, that was what's happening with my friend. That one is hard.
Yes, one is hard.
It's like it's very rock.
Painful.
Yes. So okay, you've already said this one. Small breast makes less milk.
Oh,
that's wrong.
It's very wrong.
Okay, you can't breastfeed if you have flat or inverted nipples.
You can't breastfeed properly. That's true. So you have to bring it up. That's where the partner comes in.
Okay.
To help.
Man, now
while the baby's still in utero, baby's not yet born, and there is inverted nipple, and when the mother goes to antenatal classes, that's why it's important for her to go to antenatal classes where she gets to be trained on how to handle the nipples.
Okay.
And nipple training, the husband helps at that point, suckle on the breast and let the nipples come out. The inverted nipples will get itself corrected with the help of the partner.
Okay. Look at this
one.
Then smiling
if the baby is not, that's inverted nipples don't allow babies to suck properly.
Okay.
So we need to train the mother on how to bring out the nipples. So we show them what to do. The breastfeeding counselor, the breastfeeding nurse will help the mother to, try to get the nipples out.
All right. So the fourth myth I have is formula is easier and just as good.
It's never as good as the breastfeeding. Formula, it's made from cow milk, and it's not as healthy as the human milk.
Okay. It says you can't breastfeed if you're sick or on medication.
Like I said before, it depends on what medication you are on, and you have to consult with your doctor, your consultant. Your doctor is going to tell you this medication you can breastfeed with it, that medication you can't breastfeed with it. And most times, if you read the leaflet of your medications, it tells you not for breastfeeding mothers.
Okay.
So you stay away from that. But if you're sick, you can still breastfeed. It has nothing to do with your illness.
All right. I think you've answered the final question as well. You said it says you must stop breastfeeding when baby gets teeth.
No,
Not
continue.
true. Is there a time limit when you advise people to stop breastfeeding?
2 years.
2 years. After 2 years. All right. I think that's all we have for this. Is there any advice you would like to give to moms who just feel like giving up? Or, oh yes, before we wrap this up, is there any way some mothers they say they don't have enough breast milk, or they can't produce milk? So how can they do this? How can they improve on supply?
And supply, like I said, breast milk comes with demand. It depends on how much you're putting your baby to breast. It initiates the breast milk production. When the baby latches on the breast, it helps to initiate that. So, and then the storage of the breast in the dog. So if you don't breastfeed regularly the way you're supposed to, it is not going to help.
Okay.
Not going to help. But if you do, you're going to definitely have enough. And make sure that the baby takes the milk whenever the baby wants to.
Very well said. Appreciate you. Thank you so much, Nurse Udeme. Do you have any final advice or any word of advice for, one of our nursing mothers out there?
I love to tell them, young mothers, that breastfeeding is very paramount. It's the best for your baby. It helps you bond properly with your baby. It helps prevent the baby from having all these childhood infections and diseases. And then breast milk also helps you to involute well. In what I mean by that is the return of the uterus after birth.
Okay.
So if you're breastfeeding, the uterus goes back to its position, and it helps with hemorrhaging. You're not going to the bleeding goes off on time, ceases on time. So it really, really helps. And it also helps with the hormones are
regulating hormones.
regulated, and then the baby gets what the nutrition is there, everything it's just correct. It's the perfect thing to do for your baby while you have them, not the artificial milk.
I appreciate you. Thank you so much for these nuggets. If there's anyone out there wanted to reach out to you and get through to you, how can they find you?
Diane Center. Center is the place.
All right.
We are there on Facebook. We are there on TikTok. We are there on X and LinkedIn.
All right. Appreciate you again for your time.